welcome back. Today we're joined by Dr. Stuart Youmans from Aspen Ridge Dental. Thanks so much for coming in today.
Thank you, Quinn, for having me this morning.
As always, you guys are sharing some great dental tips with us. Today we're talking a little bit about what happens once you've lost a tooth. Now, that isn't a time to just call it quits, say, well, I've lost that one, so there's nothing much I can do about it. There are some important things to remember once you lose a tooth to keep the rest of your teeth healthy. Tell us a little bit about that.
Well, that's correct, and surprisingly enough, people do sometimes just say that's one that's gone and it's not to come back. Aside from the aesthetic issues, you know, and the self-esteem issues of having a missing tooth, which are obvious, there's the functional part of missing a tooth. When a single tooth is missing, it creates an imbalance in the mouth, and it creates a space that now food gets trapped in, and patients typically avoid that side of their mouth. So that leads to all sorts of other problems, to include bone loss in and around those other teeth that are trying to pick up the work for that missing tooth, and possibly jaw problems as well. We're kind of focused on the balance of the whole patient at our office. And when you create an imbalance, that can create problems with what we call the temporomandibular joint complex, or
that's what we call it too.
TMJ, exactly.
I've had that. I had to sleep with a mouth guard.
Well, it can be very painful. It can be very devastating.
Absolutely.
So that really is where the importance of replacing those missing teeth lies. To avoid those problems and just to really keep your function at its level, to be able to eat like you were meant to eat.
My dentist said it might be TMG in my case, too much gum. He said I chewed too much gum and I had that sensitivity there. So what kind of options do people have if they're missing a tooth?
Well, if it's a one-tooth problem, you're just missing one tooth, I think certainly the most important or best option is a dental implant. We can't stress that enough. It's a one-tooth missing problem and it's a one-tooth restoring problem. So that would be the root form that goes into the jawbone, and then a crown is placed on top of that. The more traditional, as I like to call it, not the older, but more traditional restoration would be a 3-unit bridge, where you would have a crown on the back tooth, a crown on the front tooth, and a crown in between there, replacing that. Maybe not the best option in the world, but certainly far from the worst. Got
to get in there and get it done. Now, you guys have something coming up next month. Tell us about that.
Well, next month is our Smiles for Life bleaching for charity. It's just a great event. We host that for 4 months and do reduced fee bleaching. All the proceeds go to charity. It's for a local charity here, as well as children's cancer charities across the nation. And
really quickly, we also want to mention, for those of the viewers that are going to be tuning in next week, what are they going to see?
So I want to get our viewers excited about next week. My lovely wife, Melissa Youmans, is going to be here. She's a dentist as well. And she's going to be introducing probably the neatest thing in children's oral health care that I've seen yet. She'll be here next week, and I want everybody to watch next week to see. We're the only office in Wyoming that's got this product right now. And it's really going to change how parents look at it.
Excellent. Well, I know I'll be here, so thanks a lot for coming in today.
Oh, thanks for having me.
Up next, meteorologist Joe Hansel.